I want you to take a moment and think about the most frustrating experience you have had with our healthcare system. Now, most of us can come up with a frustration very quickly. And those frustrations are due to problems with our healthcare system. There are lots of problems with our healthcare system. Hundreds, thousands, millions even maybe. I'm a pharmacist, and I've been teaching and researching problems with our healthcare system for the last 9 years. And I, along with many, many others, have had the question, how do we fix our healthcare system? Now, if I were to ask those of you in the audience to raise your hand, if you have ever had that question, I'm guessing most, if not all of you, would be raising your hands right now, because we've all thought it, and yet we don't have a solution. But the lack of solutions is not due to a lack of innovation. In fact, according to Rock Health, a venture capital firm, there have been over 1,900 digital health companies created within the last 12 years. And that's just digital health companies. And in the year 2021, over $29.1 billion were invested in digital health companies. So no, it's not due to a lack of innovation. So why have we not fixed our healthcare system? Well, I don't know about you, but I get a lot of ideas from watching TED Talks. And in Simon Sinek's TED Talk on how leaders inspire great action, he introduces us to the golden circle. And in the middle of that circle is the why. Now, his premise is that ideas, innovations, companies that don't have the right why will fail. So perhaps we haven't fixed healthcare because we don't have the right why. Perhaps it's the motivation driving innovation that's the problem. In fact, much innovation comes from shareholder beholden companies. So how do we get the right why? Well, we have healthcare professionals who chose their field because they want to help people. They want to improve patient care. They have the right why. And we have examples of healthcare professionals who have used this why to innovate and solve challenges within healthcare. A pharmacist partnered with a software engineer to create a company called TruePill. It started out as a virtual dispensing model that would allow pharmacies across the country to have prescriptions delivered directly to patients' doors. Patients who live in rural areas and don't have access to a pharmacy. Patients who don't have transportation to drive to the pharmacy to get their prescription. Patients who maybe have a working schedule that wouldn't allow them to stop at a brick and mortar pharmacy during operating hours. Another example is a physician who was tired of seeing his patients unable to afford medications, and so he started his own company. And along his startup journey, he emailed Mark Cuban, who invested. And together, they opened an online cost-plus pharmacy. Now, the cost-plus pharmacy model is not unique to Mark Cuban or this physician. Many independent pharmacies have a cost-plus pharmacy business model as well. And the business model cuts out insurance companies and allows the pharmacy to pass savings on directly to the patient. Some patients are saving hundreds of dollars a month with this business model. These healthcare professionals innovated from a place of compassion. They had the right why. But in healthcare, we train our students to know the right answer, to be analytical and calculated, to prioritize the left brain thinking over the right brain, more creative thought. And in return, we get top-notch scientists, healthcare professionals who can quickly and competently research and find the right answer for their patient. Except, what if the solution to the problem your patient has isn't in the research? When I was pregnant, my OBGYN told me that I needed a prescription strength iron supplement. so sent off the prescription to the pharmacy. When I went to pick the prescription up, I was told that they would need to contact the prescriber because they didn't have that strength in stock. But they would get a new prescription for the right strength that they did carry. Great. I was willing to wait, no problem. Except it took a week for me to get that prescription. There had been a myriad of communication breakdowns or problems that need to be solved. But healthcare professionals who use innovative thinking strategies to solve these types of problems are the exception. Now, if we're going to fix healthcare, they need to become the rule. Compassionate innovation. That's the answer. What if we trained our healthcare professionals to think outside the research box? What if we trained them not just to be compassionate, but to be compassionate innovators? Some schools are doing just that. The Health Design Lab at Thomas Jefferson University is teaching their medical students a creative problem-solving framework called design thinking. They're using design thinking to solve problems like the restrictiveness of IV lines for patients who are in the hospital, to rethinking treatment for bloodstream infections. And I, at the University of Missouri-Kansas City School of Pharmacy, have started a student research group called Rebel Thinkers. And we use design thinking to solve problems within healthcare. So remember back to the story I told you about how it took a week for me to get my prescription because of the communication breakdowns. Well, my first group of Rebel Thinkers dug into this problem using design thinking, and they came up with an idea that is now grant funded, and they're creating a technology that would have allowed me to get my prescription within 24 hours, if not the first time I walked into that pharmacy. Programs like this are creating compassionate innovators that can help solve healthcare problems. Just imagine our healthcare system. If every school had a requirement for innovative skill development for doctors, nurses, pharmacists, social work, physical therapists, and all the other healthcare professionals. Imagine what our healthcare system could be if we had an army of compassionate innovators working toward a common goal to improve patient care. Thank you.